Grant. Dr. Grant attended the University of the West Indies, where she completed a first degree in biochemistry and zoology. She then went on to complete a bachelor's degree of medicine and surgery. Dr. Grant later specialized in the field of radiology. She is currently one of the radiologists on staff at Radiology West. Now, Dr. Grant, what is breast cancer?
Breast cancer is a malignant growth or tumor that arises in the cells of the breast.
What are the signs and symptoms of breast cancer?
Well, there are a few signs. Unfortunately, sometimes there may be no sign or symptoms at all, but things that you can look out for are a new lump or mass in your breast. That is very important that you get that evaluated. Any lymph nodes, what Jamaicans call wax and cannon in the armpits, in the neck as well. If you have any nipple discharge, or if the nipple is inwardly turning in, or what we call nipple retraction. Any changes in the skin, dimpling of the skin of the breast and so on, those are worrisome signs that you should look out for.
And how common is it?
Well, sadly, breast cancer is the most common cancer amongst Jamaican women. It is the leading cause of cancer-related deaths in women that are over the age of 25. 1 in 21 women in Jamaica will develop or be diagnosed with breast cancer in their lifetime. Worldwide, approximately 1.7 million women were diagnosed with cancer in the year of 2012.
Wow, and what causes breast cancer?
Some of the risk factors for breast cancer, of course, the most important thing is our gender. As women, you're at higher risk for developing a breast cancer as opposed to a man. Your age, the older you get, increases your risk. Other important causes include your estrogen exposure. So women that have an early onset of their periods and a late onset of their menopause are at higher risk. Women that have no children or have children later in life are at higher risk. As well as patients that have a family history of breast CA, patients that have a family history of the BRCA gene are also at risk.
Can it be prevented?
Breast cancer cannot be prevented, but what you can do is to do lifestyle changes that can maybe modify your risk factors. As I had said earlier, your estrogen exposure, your weight, and so on.
Okay, Dr. Grant, now what is the best method of detecting breast cancer as early as possible?
The best method for detection is a mammogram. A mammogram is an x-ray of the breast that helps us to detect and evaluate changes in the breast. There are two types. There's the film screen mammogram and the digital mammograms. Both of these types use the same technique in terms of how we position the patient and so on. The difference being that with a film screen mammogram, you're actually using film that the patients can actually physically hold and see. With a digital mammogram, the images from the mammogram are saved to a computer screen.
I see. And what does a mammogram show?
Mammograms show different densities. So it will show you the normal breast tissue, the fatty tissues of the breast, the fibroglandular tissues of the breast, which are normal. What we are evaluating is to look for things such as calcifications that may be abnormal, more so microcalcifications that may be suspicious, benign appearing masses, as well as suspicious masses.
Here is Dr. Dwayne Chambers. Dr. Chambers attended the University of the West Indies, where he pursued a first degree in chemistry and biochemistry. He then completed the Bachelor of Medicine and Surgery and did his residency at the University Hospital and also at Queen's Hospital in Nottingham. Dr. Chambers went on to specialize in radiology and has been a radiologist at Radiology West for the past 5 years. Now, Dr. Chambers, how is a mammogram done?
Hello, good evening. The first thing to remember when doing a mammogram is that it's a picture of the breast. So as with any picture, the person has to be extremely still. What happens with a mammogram is that the breast is placed between two plates. The bottom plate is the mammographic plate, and the top plate is a plastic plate that is used to hold the breast in place. This is what a lot of people, a lot of women are nervous about, because the top plate is used to flatten the breast so that we can get a high quality mammographic picture.
So is it a painful experience?
It is uncomfortable, but women should not be put off by this. It's necessary to flatten the breast because, one, the breast has to be absolutely still, and we have to remove all the overlying tissue in the breast to improve the quality of the picture. Some women can take painkillers up to an hour before doing the mammogram to lessen the discomfort that they may feel.
I see. And how does one prepare for a mammogram?
Right. The important thing to remember is that the breast should be absolutely clean. On the morning of the mammogram, the patient should not wear any deodorant or apply any body lotion, because a lot of these things have zinc and other metallic elements in them which can be confused for calcification on a mammogram.
I see. Why is it necessary to add compression during a mammogram?
As I said, a mammogram is essentially a picture of the breast. In order to have a high quality picture, the breast has to be absolutely still. The compression keeps the breast still. It also removes overlying structures within the breast, and this lessens the amount of radiation absorbed by the breast.
Chambers, are there any side effects from getting a mammogram done?
Discomfort is probably the main side effect. There can be some discomfort for a couple hours after a mammogram is done. The radiation dose is very limited, and there is no real radiation side effect after doing a mammogram.
I see. And when should women start regular mammograms?
Screening mammograms are started at 40 years of age and thereafter done every year. Exception to this is in women who have a first-degree relative with breast cancer. Their screening is started 10 years before the age at which their relative was diagnosed with breast cancer.
Is a mammogram limited to females only?
No, actually, men also do mammograms, and in fact, any elderly male who feels a breast lump should come into our facility to have that lump investigated, and a mammogram may be one of the investigations that we use.
Thank you, Dr. Chambers. We're here with Dr. Conrad Curlew. Dr. Curlew is one of the founding members of Radiology West. He attended college at the University of Florida and subsequently Stanford University School of Medicine. He was also a chief resident at the University of California, Los Angeles, the famous UCLA. Now, Dr. Curlew, what if a problem is detected after a mammogram screening?
Well, if there's an abnormality on the mammogram, the screening mammogram, we have to then determine whether this is something benign or something cancerous. And the two main ways of doing that are with ultrasound. Ultrasound will allow you to look at an abnormality and determine whether it's solid or is cystic, has fluid. And based on the appearance on the ultrasound, we can say, okay, this is something to worry about or something not to worry about. If it's worrisome, then we recommend a biopsy. A biopsy is a procedure to take a bit of the tissue of the abnormality and send it off to the lab to determine whether it's cancerous or not. The second way of evaluating abnormality is with an MRI. And we don't do that as commonly, but there are certain selected situations where an MRI can help us determine if a lesion is cancerous. It can also help us determine if it's spread into the surrounding tissues, if there are more than one area of cancer in the same breast, and even at times in certain types of cancers to make sure that there isn't another cancer in the other breast.
Okay, and Dr. Curlew, could ultrasound therefore be a permanent substitute for doing a mammogram?
Ultrasound is not a substitute for mammography because cancers typically present in one of two ways. They can present as lumps, and they can present as what are called microcalcifications. So this cancer that's growing in the ducts. And you will not be able to see microcalcifications very well with ultrasound. Therefore, you would miss all of those cancers if ultrasound was the only way of screening for the mammography. So we use both mammography and in selected cases, ultrasound, and they complement each other. They can show us things that the other can't show you.
I see. Dr. Curlew, what modifications are made while performing a mammogram on a patient who has implants?
Patients who have implants tend to get an extra set of images to look at, one, the implants themselves, and two, the normal tissue around the implant. So the technologist positions the breast such that one set of images, such as some of the ones you're seeing behind me, show the implant, and then the other set shows the normal tissue around it.